So this is oxygen supplementation for the nasal cannula. We're obviously going to put a pulse oximeter just to make sure we're checking their SpO2, we're making sure their oxygen saturation is correct. As of right now, it's not normal, so she is required to need it. No rescue breaths are needed for our specific patient. This is the nasal cannula. You're going to go ahead and insert the end of this tubing into the oxygen tank, and the tank is going to be at this end. You're then making sure that it's working. You're then going to make sure that you have the dial at 0. You're going to go ahead and turn the dial. So after you have it open, you can go ahead and turn this dial to 6. And you want to make sure you're hearing that oxygen flow. So you should be able to hear that oxygen. These prongs are not going to hurt, but I'm going to go ahead and put them on you. We're going to put them at first at your chin. So I'm going to go ahead and put them on you. And going around your ears. Up into your chin. And the way we know that you're going to take this off is your oxygen saturation rate is going to go back to normal, which is 95 to 100 SpO2.
Okay, these are our instructions for using a non-rebreather mask. So first we're going to put the post-ox on, but because the patient has colored nails, we're going to use her lightest colored nail. If not, we would have to do her earlobe or her toe. If she had polish on that, we're going to have to figure something out. So we're going to confirm with the patient that there is no rescue breathing is not required, but because this is a demonstration, the patient does need some supplemental oxygen. So I'm going to provide some oxygen. What this is going to do, we're going to fill this up with oxygen. I'm going to place this around your head, and you're just going to breathe as normal as possible, okay? So this is already connected, but this is the end that we would connect to the oxygen tank, and then this end we're going to apply right here to the mask. You just twist it on. So, oxygen source. We have the right size mask. If child, adult, infant, this is an adult because our patient is an adult, so we'll go with that. So now we're going to open the valve. Then we're going to adjust the liters to 15. And as I'm adjusting, I could hear the oxygen coming through. We're gonna let this fill up, We're gonna let this fill up. Okay. The reservoir is now full, so now I'm gonna place this over the patient's head, making sure it's not gonna snap her. And what she's gonna do, the oxygen will be going through. I just want you to breathe as normal as possible. I'm gonna keep doing this till her oxygen levels are back to normal.
Okay, so this patient is not breathing. We're gonna activate EMS. We're going to apply the face mask to her nose and mouth, making sure it's closed off. Then we're gonna open the chamber and move the dial to 15. We're gonna listen for the noise to come out, and we're gonna continue to give rescue breath.